obviously we are in the season of upper respiratory tract infection, starting with influenza and ending with a nasty pneumonia. We'll go through multiple microorganisms that are more susceptible or common to cause this infection. Obviously, we'll be starting with the common bacterial infections, and at some point we'll be covering the viral infections. Okay. So streptococci and enterococci. So streptococci, they come in pairs, and the way we differentiate, if we were to discuss streptococci, the way they are differentiated in terms of the hemolysis for the red blood cells on a blood agar, that's the alpha, the beta, and the gamma hemolysis. Gamma hemolysis in this case means there is no hemolysis, okay? فإحنا we normally use biochemical testing to differentiate between various types of microorganisms, okay? Catalase, oxidase, and the capability of lysing the red blood cells as well. All right, so alpha hemolytic, that's partial hemolysis, such as strep pneumoniae. Beta hemolysis, that's a complete hemolysis, such as group A and group B, strep pyogenes and Labilacia. And the alpha hemolysis, that's the enterococci. In general, as you can see in the image here, you can see the, okay, so you can see it. You can see the pairing. That's a distinctive morphological feature for streptococci in general, okay, alpha, beta, or gamma. So pairing is an interesting fact, and it helps us differentiate from Staph aureus, which comes in chains or clusters. Hemolysis, obviously, green or none or complete, as I mentioned, and the various enzymes that helps us distinguish it from others, okay? So strep biogene, group A streptococci, serotyped by the M protein. We have probably one of the most common throat infection among children. Labilacia, another name for it اللي هو group B, وهاي بنشوفها أكثر بال UTI, urinary tract infection. Strep pneumoniae, the famous one with the capsule. With strep pneumonia and its capsule, there is a story on the vaccination and the updates for the vaccination. We'll be discussing it here in a minute. Strep viridans, more related to the oral health. I believe we've discussed this before sometime last year, in which we said anything has to do with the oral health is tightly linked to the cardiac health. So it's tightly linked to myocarditis, endocarditis, and so on and so forth. Enterococci and bovis as well. Okay? So quick refresher for the differences between strep and staph. That's the basic. As you all know, staph is part of your normal skin microbiome. The bunching, the grape-like feature of Staph aureus, and some of the chemical activity such as ability to catalyze proteins, and that's the catalase positive for Staph aureus, releasing gases, and like strep, which is negative. Okay, so this is a quick recapture from before, and we'll start with group A. A mom would take their child to the clinic, fever, lethargic with inability to eat, drooling, and you look down the throat and it would be red, indurated with inflammation, and that's most commonly we do a swab, and the swab is rather fast for diagnosis, and that's your beta hemolytic, aka partial hemolysis of the RBC, and that's your strep biogene. Okay. Complete hemolysis, my mistake. So the alpha is the complete hemolysis. So hyaluronic acid in the capsule is a distinctive feature. It is a distinctive feature as well as with the M protein because it has this property of inhibiting a innate immune response of phagocytosis, and that's one of the virulent factors for strep biogene. As I mentioned, strep throat is probably the most common. Impetigo and cellulitis, I'll show you the images in a minute, is another manifestation for this disease. Toxic-mediated diseases such as scarlet fever, all the way to toxic shock syndrome is also possible. Now we've discussed toxic shock syndrome.
with Staph aureus in details, this might also give you similar manifestation. So scarlet, necrotizing fasciitis, and toxoid syndrome. And that's very important to understand, not everybody who gets a strep throat will end up with rheumatic fever or post-strep glomerulonephritis. Okay? So those who are susceptible, they are immune weakened or immune compromised. That includes people less than 5 and above 65. Okay? That includes people with chronic debilitating conditions such as diabetes and COPD in this case. Alright? So there are a lot of erythrogenic or pyrogenic toxins such as exotoxins, causes fever, obviously rash, superantigen, same superantigen that we've discussed before, in which the binding is a constitutive activation, in which it creates a chemokine-cytokine storm that leads to an exaggerated inflammation. Streptolysin O, an antigen caused by beta hemolysis, and also it has an oxygen stable toxin, but it's not an antigenic. AKA when we say it's not antigenic, it doesn't incite the inflammatory system as much as the antigenic streptolysin O. So streptolysin O is the antigenic one that is causing beta hemolysis, that is partial hemolysis of the RBC, streptokinases, and many other proteins. And we did highlight in the previous slide the hyaluronic acid capsule and the M protein. And anytime, a rule of thumb in microbiology, when there is a capsule, this is a virulent property and primarily protects from an innate immune evasion, which is the phagocytosis. So the M protein as well as the hyaluronic acid serves that purpose. Now, if the subject occurs to be or happens to be immune weakened, then you are looking at post-strep glomerulonephritis and or scarlet fever, okay, or rheumatic fever, and that's the story. A very interesting correlation you will see on the board exams, in which they brings you somebody young, rather usual infection, strep throat, and then all of a sudden you start seeing the manifestation of renal involvement or rheumatic-like disease involvement. So you can make the link and know that the association here is telling you this is strep pyogene. So that's strep pyogene. The toxin, the pharyngitis, the scarlet fever here. So we'll go through it. So this is impetigo, for example. Impetigo, when it's presented, it will be presented like this. And في الحياة الحقيقية, if you are in the clinic, you're probably going to see it like this in this location. Now, confined honey crusted lesions. Honey من اللون yellowish crusted lesions on the face and sometimes in the extremities as well. Okay, so that's pyoderma or impetigo. Cellulitis, normally it's the presentation of cellulitis with deep tissue infections on the skin with swelling, redness, and all the calor that we know of. Scarlet fever, after the pharyngitis, you will have a diffuse sandpaper rash, starts, نشوفوا pathognomonic here. How does it start? Starts at the neck and spread to expand to the rest of the trunk. That's your scarlet, okay? Pharyngitis بتعرفوها اللي هو regular strep throats. Erysipelas as well. Again, this one and the other one and the last one. So toxic shock syndrome, necrotizing fasciitis, and erysipelas can be easily confused for Staph aureus. That's why we showed you the initial image in which we try to simply distinguish them. يعني لو تاخذ swab, put it under the microscope. If you see a diplococci, most likely dealing with strep. If you see chains and clusters, grapes like morphology, that's most likely Staph aureus. So that's the difference between the two. You can do it with the catalase biochemically as well. And there are many other tests that helps us distinguish between the two. So this is necrotizing fasciitis. يعني لو ما بنحكي على microbiology, you're probably thinking this is a burn. Okay? That's how bad and this is how severe. And again, as you can see, this microorganism have taken so many slides already because it is really common. ماشي? And we get to see it, especially pediatrician, they get to see it a lot in their practice. Pharyngitis is the obvious manifestation for this disease. Scarlet fever, it was sandpaper rash and the strawberry tongue. And when we discussed it, we said there is a pathognomonic feature for how the rash would spread. Starts centrally and moves to the trunk and to the rest of the periphery. Pyoderma impetigo with the honey-crusted lesions. A lot of these concepts are high-yield exam material as well as stuff that you will be actually seeing in your clinical practice. When we teach you microbiology, we make a point to teach you medical microbiology, in which we highlight the things that you will see in your clinical practice, and we shy away from diving into molecular microbiology and discussing more the virulent factors, their conformational changes, and the actual physics and the biochemistry behind the toxin and how it works. Every now and then we'll touch on it, but the way we're presenting things to you, it's more medically oriented. That's how you are able to do a proper management for your subjects when you see them in the clinic. The sequelae here is the important thing that we need to highlight. The sequelae is rather dangerous. We hear a lot about people who go into elective surgery for any purpose, and they end up with kidney failure due to mistakes, due to an inappropriate antibiotic, due to side effect, due to allergy. But the point is, kidneys are one of the very important organs that if they are hit hard, it may affect the viability of the subject altogether. Actually. So people die from renal failure. Okay? But imagine a young child who is still growing, adapting, and he keep getting the strep throat, and every time and again بتشوف smoky urine والمام تيجي بتحكي لك انه smoky urine او cloudiness او اليورين تبعه مش clear او that tells you that there is these immune complexes. If you were to understand where this is coming from, it's coming from the reaction of the innate immune responses and the adaptive, in this case, bound to the glomeruli associated with pulmonary edema, leading to what we call smoke urine. A frequent buzzword on the board exams. Okay, rheumatic similarly, with the antibodies goes to the heart tissue, and then you will end up with possibly some sort of carditis, myocarditis, endocarditis, pericarditis. It's all possible. The trigger here is the antibodies. Okay, the antibodies that has formed as a result of this infection. So مهم نفهم pathogenesis of the bug, the mechanism, the toxins, and the sequelae are important in terms of management. That really comes in handy. So here you can see the strawberry. You can see the strawberry throat. Punctate hemorrhage. احنا لما نحكي strawberry مثل حبة الفراولة بتكون فيها زي punctate نقاط حمر مش هيك؟ But that's where it comes. This is the hemolysis and this is the capsule. And normally for necrotizing fasciitis, obviously it's a more rigorous treatment, including surgical intervention. The treatment, unfortunately, is not available. No more available. If you go to any pharmacy nowadays, حاول or good luck finding penicillin. Okay. And this is something I was discussing earlier this morning. Part of antibiotic stewardship. How can we make the antibodies, the antibiotics that work still available in the market and being used, instead of using unnecessarily a broader spectrum antibiotic that will necessarily contribute into the emergence of more resistant strains. This is one of those diseases, penicillin still work. Yet nobody gives penicillin. If you go to any pharmacy, you will not find penicillin. Okay, so that's a story, something to relate to when we discuss antibiotic stewardship. Okay. Next, we'll move to agalacia. Agalacea, it has an interesting virulent factor or an interesting test. It's a polypeptide. It's a beta hemolytic, produces a CAM factor. The extracellular surface enlarges in the area of hemolysis وبيبين how it looks like. Looks like what? Do you see this shape right here? If I have your attention, do you see this shape? This shape looks like what? Looks like an arrowhead. شو الارrow؟ السهم أو الرمح. Looks like an arrowhead, so that's a CAM factor positive, such as Agalacea بايجين اللي هي هون في hemolysis بس ما أعطاني الارrowhead. شايفين الفرق بين this one and this one? Between A and B? واضح؟ Remember this since you are in attendance, which is, I really appreciate that you've attended. Okay, so back to Agalacea. It's part of the normal lower GI, genitalia, and urinary tract. So it's part of the normal microbiome of that part of your human anatomy. Nevertheless, every now and then, a disturbance in the immune system, in the hormonal regulation that enables the immune system to dip, the surveillance will go down, enabling any opportunistic bug who lives as a normal part of the microbiome to establish an infection. The problem in this case, the location. So UTI alone is not a problem, but UTI for a pregnant lady is a problem. The problem here because it has the risk of transferring into the newborn as a gift as they pass through the birth canal, and that's here is a testament to the importance of prenatal testing and treatment to protect the newborn passing through. So neonatal bacteremia is a very serious disease. Anything emia is a serious disease. Any bug in the blood is a serious disease that might very well lead to meningitis and pneumonia. Tamam? So that's the story. And nursing homes and staff are at risk as well. True nursing homes, people who are elderly, فهم by default إيش? Immune compromised, and thereby they are at risk. They are at risk. Agalacea has been seen time and time again on the board exams in connection with pregnancy and neonatal health and perinatal screening and treating women at risk to prevent that unnecessary bacteremia and meningitis and so on and so forth that might affect the fetus health, even all the way to pneumonia. Okay, so this is the prevention. In my opinion, this is very important. Okay. Normally there is a culturing that occurs على كل trimester. So you culture and there is a group B strep positive. Then شوف شو العلاج ما أحلى penicillin. مش موجود الأردن ما فيها penicillin. Prove me wrong. Tell me doctor I found penicillin بالأردن. Alright? I'll be happy to hear that news. Penicillin, I think something that was produced in 1945. That was the ushering the era of modern medicine. الطب الحديث كله بلش من لما احنا قلنا this is the correlation between disease and microorganisms. بطلنا نقول أرواح شريرة. طلع لا في ميكروبات هي اللي بتخلي الواحد يصير عليه حرارة. It is the cause. The story started before that when they discovered the microscope. تجار الخيوط والحرير والكذا كانوا يعدوا the thread counts. So when they were counting the thread counts, some of them noticed, they saw things moving on the threads. And that's how they become discovering there is microorganisms. Then other scientists came after that and established a correlation between these microbes and diseases. And then accidentally, Alexander Fleming noticed there is عفن, fungi, penicillium, grew on the plate. نسيه راح إجازة ورجع. فhe saw a zone of inhibition. العفن produced something to inhibit the growth of the bacteria, and that's penicillin. People after him came after and after لعند 45, over 50 years in the making. من an initial observation إنه العفن killed some bacteria to the actual successful production and use of penicillin in 1945, saving thousands and thousands of soldiers' lives اللي كانوا by the end of Second World War. ومن هذاك اليوم we ushered the era of modern medicine. We start using antibiotics, disinfectant, detergents to fight with bacteria. ومن هذاك اليوم we entered into a vicious cycle of resistance, emergence, new antibiotic, resistance, emergence, new antibiotic, وهكذا. Some ethical, some unethical due to big pharma and their profit making. And that's all كله covered under one big umbrella. قلنا stewardship, antibiotic stewardship. To be responsible for dispensing antibiotics is a decision of you as a clinician, it's a decision of the pharmacist, the allied healthcare worker, and the microbiologist in the lab. يعطيك proper diagnosis, MIC, minimal inhibitory concentration, تمام? So we can preserve the integrity of the biome, لأن the biome itself fights the pathogenic and hindering its ability to cause disease. تمام؟ وthis is actually proven. وهلا في FDA studies بتحكي انه انا بدل ما اعمل احط هون ديتول مشان امسح هذا الديسك ونطفي من الميكروبات، انا بحط عليه نوع ميكروبات ما بضر البني ادم وبقضي على الميكروبات الثانيه الموجوده على الديسك. So this is under trial as well. بسموها biocidal agent. Biocidal agent. يعني تقتل البكتيريا بالبكتيريا. It's an interesting concept وإلها محاذيرها obviously. بس احنا we ventured out شوية نرجع لموضوع ال neonatal care وموضوع how do we properly manage our subjects. So that's Agalacia and that's their correlation and how do they live with the biome. Pneumonia, obviously, it's of a prime interest, okay, alpha hemolytic, partial hemolysis. Again, مثل Staph aureus, strep pneumonic is part of the normal throat, oral, and partially skin microbiome. So how the disease arises? Disease arises under the right circumstances. The bug takes up the opportunity to establish a bigger colony and then disseminate, causing a disease اللي احنا نعرفه. This is normally associated with cough and rusty sputum, indicating blood that comes from the inflammation and the cough that could lead to meningitis and other types of diseases. Kids comes in with otitis media that may or may not lead to pneumonia. الحكي بالعامية بينزل على صدره، ببلش بالإذن، ببلش بالحلق، بعدين تيجي بتحكي لك الأم نزل على صدره. نزل على صدره يعني established a pneumonia, which is usually very bad news. Obviously, مشان to distinguish it from Staph aureus, it is catalase and peroxidase H negative. Good? Number of predisposing factors, as we've discussed before, كلها بتلف حوالي one thing, immune weakened, immune susceptible, all right? And then the polysaccharide capsule that protected from phagocytosis, proteases and pneumolysine O that damages the respiratory epithelium, inhibits the leukocyte respiratory burst, and resulting in what? Rusty sputum. Rusty بالعربي شو يعني؟ صدى. As if صدى. فالصدى in this case بيكون bright red ولا شوية على brown yellowish؟ brown yellowish. So that's our rusty sputum. إذا bright red شو بده يكون؟ active bleeding. Exactly. And that's usually as a result of an injury. ما هيك؟ So we ought to be careful in our clinical description, especially انتم لما تكتبوا history taken, how to examine and document your examination. ما بتقدر تقول bloody cough. Bloody cough could mean upper respiratory bleed, and it could be a strep pneumonia infection due to pneumolysine O. Due to pneumolysine O. كويس تعرفوا pneumolysine O ماشي للstrep pneumonia, and the rest of the correlation. Quilling's test, one of these reactions is serotyping. لأنه قلنا احنا pneumonia في لها vaccine nowadays وفي there are 23 مكتوبة مش مكتوبة pneumovax هلا في polysaccharide there are 23 pneumovalent antigens to لأنه بتعرفوا الجينوم تبع pneumonia. These are the things that we don't necessarily go into details when we discuss these things with you, because it limits your medical capacity. So we try to shy away from the molecular and teach you more on the medical side. So there are genomic rearrangements. And the antibiotic that works for substrep pneumonia sometimes does not work for other strep pneumonia because of the restructuring of the proteins اللي بتشكل أو اللي forms the capsule for you. So one day a macrophage comes and phagocytoses that strep pneumonia. Another day it doesn't, it cannot, it's unable to. But the job of the scientist is to keep providing an updated pneumovax. I think we are up to 28 now, okay? Various serotypes to cover various strains of strep pneumonia circulating in Jordan, in Irbid, worldwide, and so on and so forth. I love this because, again, the treatment here is what? Penicillin. Nevertheless, has been modified with, without allergy, broader spectrum antibiotic, the risk of mixed infection. But mixed infection is a real thing. يعني you don't necessarily have to be infected with strep pneumonia alone. Okay? And that's the story with the prevention of strep pneumonia. An interesting concept. Very dense, we'll cover it quickly. It is resistant, optosin resistant, bile insoluble, alpha hemolytic. And they come in chains, and they are, from the name, very dense, related to the dental caries and dental health. And anything, the rule of thumb, what I mentioned earlier, stands. Anything relates to the oral health, immediately connect that to the cardiac health. لماذا؟ Someone knows? تعرفوا ليش؟
مش لما تفشي اسنانك بس عندك بكتيريميا.
Transient, أحسنتي. The transient bacteremia. That's the buzzword. If someone has biofilms that have formed over and over again, احنا بنحكي the standard brush your teeth twice a day. If they didn't brush their teeth for 3-4 days, when they brush their teeth, they would notice ايش؟ Bleeding. Even more so when they floss. مظبوط؟ When they floss, they will get a lot of bleeding. Bleeding هذا بيجي from microbleeds from the capillaries, enabling or opening up highways للbugs from the oral cavity to grant transient bacteremia, وبتروح وين بالبداية؟ على الpump, to the heart muscle, endocarditis, myocarditis, okay? Especially if there is the tiniest imperfection in the flow بالheart muscle, بصير الانفlammation هناك, and that's really bad news, okay? So that's very dense. I don't want to stick too much عليها. زي ما انتم شايفين, infective endocarditis, and one of the predisposing condition highlighted for you, poor oral hygiene. And again, penicillin G does the job. And the prevention here is two things. Obviously, maintaining a good oral health. By the way, your oral health is everything. It reflects your overall health, by the way. Number two, prophylaxis. تروح عندك inflamed tooth. The first thing the dentist would do, prescribe antibiotic, complete the course, and then come back to do the extraction. They will not dare to do the extraction prior to that, because during the extraction, there will be a lot of bleeding, a lot of bacteremia, a highway for so the bug, when it lands on your body, I mean, their ultimate prize, their ultimate goal is to grant access to the bloodstream. And that's where they float and go everywhere, establish infections everywhere. Any manipulation in the oral cavity for dental work or so on and so forth really poses a very high risk of damaging the heart muscle. And it's an accumulative insult. مش بيوم وليلة, يعني مش one time thing, لا. Over and over and over again, they might end up with that problem. And then enterococci, اللي احنا بنسميها group D, okay, they are PYR positive, مثل group A strep, and they're serious infection of the endocarditis, and again, treated with penicillin and ampicillin, and aminoglycosides. And there is Povis, which is more with cows. And again, the correlation here is with carditis and the common site here, urinary tract, UTI, and gastric. So normally, this is associated with a GI intervention. Okay? Grows well على sodium, similar to Staph aureus in this case. Again, the common feature here is immune compromise and having a highway such as the urine cath, establishing an easier climb access biofilm formation that gets it to do the job rather readily. Okay, renal failure with dialysis, obviously. So that's the story. Epiglottitis, pediatric epiglottitis with the Haemophilus influenza type B. Conjugated vaccine largely eliminated this problem. So, هون في نقطتين. The point of knowing about this issue and the point of being able to spot someone due to forced migration, refugees, conflict, war conflicts, اللي بدك إياه, that would result in they are unable or they lost access to the vaccine. Oh, he lives with a hippie parents in California and they don't believe in vaccine. كله possible, okay? But the bottom line, establishing epiglottitis results in a very serious pediatric emergency. So obviously it is capsulated, has 6 different serotypes. Strep pneumonia عندها 28 different serotypes as I've mentioned. والrearrangement تبعهم dictates the recognition by the immune system. So we are to provide an updated vaccine to prevent Haemophilus influenza type B from causing epiglottitis. We all agree that it is a medical emergency. Now, because of that, بيعملوا serotyping موجود كثير. في الهب A, في non-hib, وفي non-typable, and people try to do serotyping as much as possible to serve that purpose. And as you can see here, this is the estimated in the US for the by age group and the serotype, and you can notice that non-typable is more على وين؟ على geriatric age group, less than 5 and above 65. Non-typable. Please take a note of that. Okay? Now, what is that relate to Jordan, ya doctor? I don't know. Alright? So hopefully we'll have our own data at some point, and thereby we are able to deal with this rather serious pediatric emergency when that occurs. شو المشكلة وين؟ هو inflammation. شو موضوع الانفلاميشن؟ ليش pediatric؟ شو اللي بصير هون؟ Why this is an emergency? Because it affects the airway. It blocks the airway. So in the operating room, emergency room, or ICU. So that's what we call safe environment. The moment someone comes in, drooling like a dog, okay, very sick, toxic looking, and drooling, يلهث باللغة العربية. أول إشي لازم تعمل, you need to take them to a safe environment. A safe environment in this case is defined by operating room, emergency room, or ICU. مين موجود بالثلاث أماكن هاي؟ دائما بكون موجود. أحسنتي. Yes. Anesthesia doctor and or anesthesia kit. To do what? To preserve the integrity of the airways. Highly inflamed throat due to the epiglottis. The moment you touch it with a dump depressor, بزيد الانفلامation and the child will suffocate. بموت خنقا. تخنقه خنقا. ماشي؟ If we are in the business of saving lives and making lives better, أول حاجة, let us not cause harm, okay? Let us at least save these kids. So pencil point narrowing, thumb sign, and the laryngoscope is different diagnosis, and here is your thumb sign. This narrowing is due to what? To the inflamed epiglottis, مظبوط؟ هاي شو هاي؟ وين راح؟ This is an inflamed epiglottis. عم تنفليت, تكبر تكبر تكبر. والبيبي or child is drooling more and more and more. Toxic looking fever with drooling like a dog. Okay? فهو مش ضايل هالقد, هاي الهواء عم يفوت من هون بس. فأنت بتحط التانك ديبرسر مشان تشوف حلقه, لأن أنت زلمة دكتور فهمان بس بزي يعني مستعجل. You kill them right there, right then and there. إذا ما كنت بsafe environment in which there is a ventilation kit or intubation kit عفوا, or anesthesia doctor who can help you, he will suffocate and die. بكل بساطة. So this is the stump time, children less than 4 of age, and that's the prevention, and this is the treatment. Ceftriaxone, ampicillin, sulbactam, كل ما هذول they can treat, but the prevention is obvious, it's vaccination, مش هيك؟ That's the prevention. But إحنا هون اللي عم نحكي في عليه life saving procedure for the subject at risk. ماشي؟ This is the story of Haemophilus influenza. The story قصتين. نعم.
ما دكتور أسوق في الفندي بده يسوي هون الجهاز عشان يبنت بكره مشات بكره. لو بفوت يشتغل عادي؟
خلص بفوت. مش مطول 10 دقائق ربع ساعة.
إن شاء الله.
حياك. طيب. The two things you take home from this, there is a vaccine. It's serotype 1 to 26, so it's not a big of a deal مثل لما هسه ستريبنيمون اللي بدوروا على الحج على الحمرة على أي crowded prisons, jails, nursing homes, when there is crowding مش هيك؟ شو بنحكي لهم؟ خذ المطعوم مش هيك؟ Right, now for group سهل يعني ما في إشي. But if someone have missed it, as I said, we live in a very hot area in which there is a lot of conflicts. It's ongoing. يعني as long as I can remember, in the Middle East دائما في conflicts. من الجولف region, من العراق, لسوريا, للبنان, لفلسطين. It's always a conflict. So, أنت as a clinician, when the history is a black box to you, وأنت ما بتعرف, تمام? The baby is really toxic looking, he's really sick, and sometimes drooling like a dog, then most likely, I'll examine their throat, but I'll do it at least in a safe environment. And we already defined what a safe environment is, okay? وهذا common sense يا اخوان، ماشي؟ مش تلقوا والله الدكتور حكى لي اعملها بالامرجنسي، طب فرض الامرجنسي اللي انت بتشتغل فيها ما فيها intubation kit. صح ولا لا؟ وبرضه احنا لازم نكون واقعيين، احنا سميناهم safe لانه we expect انه الintubation kit and or the anesthesiologist would be around most of the time. So that's the story. Portadilla, whooping cough. من الاسم الووب، شو يعني whoop؟ He cough, and then he tried to gasp ايش؟ A breath. That's whoop. Portadilla, gram-negative, pathogen, again capsulated, and the interesting thing about it, the cause of the disease is the ADB ribosylation of the GI alpha subunit that increases the level of cyclic AMP. That results increasing in the inflammation. It grows على Congo red زي ما انتم شايفين هون, potato extract or charcoal media as well as you can see in the image. And the whoop is the characteristic in these kids. لو ما حلكوا أنا بفتح على يوتيوب, I would actually see what the whoop looks like and sounds like. Whoop. Cough, مع quick inhaling. Okay? That's Portadilla pertussis, and the others, they are less common thereby, won't be discussing them as much. The toxin, as I mentioned, the mechanism of action here, we are mentioning it. So hint for you that this is important. Activation of the protein kinase, resulting in excessive secretion of mucus. طيب لما يكون في mucus كثير, الجاج reflex جسمك بشكل طبيعي wanna cough. So a child would cough so much, they are unable to be able to breathe. But they have a very short window of whoop, so they can inhale as much as they can to simply breathe. عرفتوا? And this is مثل ما حكينا splicing O, the connection with the previous bug. This is the connection with whoop. Okay? Attached to the cell, filamentous and hemagglutinating, and other tracheal toxins. هاي حلوة حبيتها ليش؟ Inhibition of cilia movement. انتوا بتعرفوا انه في cilia movement in the anatomy, and do you know how they pulse? Governed by hormonal regulation, they literally pulse, and their pulsing varies from the day to the night, nocturnal or unnocturnal pulsing, helping clearance mechanism. But when there is this tracheal cytotoxin inhibiting the pulsing, making the coughing and getting rid of the mucus as a result of the pertussis toxin, even more challenging, resulting in the whoop. مشكلة الووب بالدي كير سنترز لأنه إحنا عندنا مرأة عاملة و ثقافة مجتمعية هاي بالنهاية بس nevertheless the disease is highly communicable بالcough. The droplets airborne in the droplets and spreads among these kids causing the disease to spread more and more. It comes in stages وعملت لكم هنا الكتارال stage اللي هو at least 1 to 2 weeks in which the cough starts. طبعا obviously starts with a cold symptom بعدين start coughing and then paroxysmal stage 2 to 4 weeks of convalescence in which بيرتاح بعدين بيجي ايش؟ sudden severe repetitive coughing attacks شو سميناها؟ whoop. Whoop due to the swelling of the glottis and the accumulation of the mucus thanks to the toxin and we explain the mechanism of action. Here unfortunately يا اخوان شو مكتوب؟ Antibiotic at this stage do not modify the course of the disease ولكن شو بيعملوا؟ Prevent the spread to other kids. And that's the story. Complication, bacterial infections everywhere else, including the otitis media. So this is the early stage symptom, late stage symptom, and hopefully recovery around last 2 to 3 weeks for the susceptible infections for many other months, obviously. And that's the story of whooping cough. Diagnosis, ELISA and PCR, always. Molecular testing, يا إخوان, by the way, molecular testing have taken over many of our traditional microbiology, and that's a good thing because of the sensitivity and the specificity. فشو حاطين عليه احنا هون؟ Test of choice, PCR. Serology okay, culture is fine. We mentioned the charcoal, we mentioned the tangorid, but obviously PCR is your tangorid عفوا. PCR is your obvious of choice. Medications of microlyze and prevention. Prevention موجود وزارة الصحة معمول فيه and it's given على 2, 5, 6 and 4 to 6 years. هاي the stages that هون ليش نعطي الدي تاب؟ How many times you get the T-TAP? 3 times مش هيك؟ على various age groups هاي بسموها boosters ليش؟ To boost the immune and the memory to make this long lasting effective لأنه disease is dangerous. And adults who missed their vaccine altogether كمان في لهم Tdap بنعطى على 11 to 12 and then those between 19 and 65. So there is prevention and it's there. آخر حبة أو آخر microbe that we'll be discussing today related to the upper respiratory tract infection is Coronium bacteria, diphtheria. Diphtheria, again, it's a problem in non-immunized crowded communities. مثل مخيم الزعتري, if it's not immunized, for example. So you're talking about forced migration, crowded, unsanitary conditions, and so on and so forth. So you're dealing with gram-positive, non-motile. The shape is rather distinctive with the bipolar. شو مكتوب هون؟ Pleomorphic. Pleomorphic أو club. شو يعني club هون؟
زي البيسبول بات.
أحسنتي. مين بتحكي؟ شطورة. So like a baseball bat or like a poorly wrapped cigar إذا بدكم. So pleomorphism يعني ما في شكل محدد. في varietic malaise node and then pseudomembrane. And that's your pseudomembrane. That's distinguished for Corynebacterium diphtheria. And then the toxin here is interesting one. A toxin here utilizes a transport system called the AB exotoxin. The A is the toxin, اللي هو catalytically active component, and the B is the shuttle, is the vehicle that enables the toxin to travel, binds, and being internalized. So if we were to follow this, here you have the B subunit binding, internalizing it. كيف بصير الinternalizing? تعرفوا كيف البinding internalization? Once the bindings occur and the binding is saturated enough to the receptor on the surface of the cell, بصير transformational changes, an actual biochemical movement that enables the toxin to be internalized into the A part. So the A subunit here is the catalytically active. لما نحكي biochemistry, it inactivates the elongation factor 2 على ADP ribosyl transferase E2, which involve the translation of the mRNA proteins. يعني AKA ببطل يصير عندي translation. It breaks the chain of translation, and that's how the toxin works. It destroys the production of proteins, and that's
lethal لأنه له علاقة بالنيورونال and heart cell lethality. Okay, so this is a diphtheria toxin, AB exotoxin. Clinical eye here is rather important. Here you are looking at a 10-year-old boy with severe diphtheria. شو بتشوفوا عليه؟ شو الشغلات اللي بنشوفها عليه وممكن to be reviewed on the board exam? Diphtheria with conjunctivitis, pharyngeal membrane, bull neck, and myocarditis. اللي what you can see, red eyes, you can see bull neck. شو يعني bull neck? Thicker neck and pharyngeal membrane, and that kind of gives us the distinction for this. Telluride will inhibit most gram-positive and gram-negative bacteria, enabling the culturing of this bug. So resistant to telluride, and thereby you can see it, and it's also urease negative. So that's culture and metabolism. The Chinese letters has been correlated, the way they grow or the pattern, because of the pleomorphism. ماشي? So Chinese letter, something you may see here and there. Maybe it's a vignette يعني, to kind of give you a hint that this is diphtheria, to distinguish it from other upper respiratory tract infections. And that's the conclusion of today's talk. And thank you for attending رقم 1. Well, thank you for paying attention. Now, I'm making myself available to you, so feel free to email me or send me Teams على MS Teams. If you look up my email, you are able to send me messages on Teams as well, okay? ويعطيكم الف عافية. طبعا obviously today we've covered upper respiratory tract infection. Tomorrow راح ياخذكم الدكتور أسامة for 2 lectures back to back. And that's it. كونوا بكرة الخميس، ماشي؟ احنا اليوم غطينا today and tomorrow's lecture. واضح؟ وبكرة الخميس بتروحوا بكير على البيت. أعطوني بس الغياب وشكرا لحضوركم. بارك الله فيكم.